Which of the following is the most appropriate initial treatment for this patient? A 35-year-old woman presents to her primary care physician with a 1-week history of petechiae and easy bruising. She denies any recent illness or medication use. Her vital signs are stable, and physical examination reveals multiple petechiae on her extremities and several ecchymoses on her trunk. The laboratory study reveals a platelet count of 30,000, a normal WBC count, and a normal hemoglobin level. A peripheral blood smear shows no evidence of platelet clumping. Which of the following is the most appropriate initial treatment for this patient? No, okay. I'm trying to think of the exact, like, okay, so multiple petechiae and on her several ecchymoses on her extremities and trunk. And now she has a low platelet count. Okay, so vitamin K would not help with this at all. Rituximab is a CD20 inhibitor. Like, I don't think that would help. Corticosteroids is an immunodepressant. I don't think necessarily. I don't know. I'm leaning towards this platelet transfusion just because she has lack of platelets and everything else seems normal. So I'd go with that.
Okay, so for one, let's first say that, I always say this, but this is more of a step two question, so not really fair, right? But this seems like a immune thrombocytopenic
That's
purpura.
what I was thinking it was.
Yep. So the initial treatment is usually you want to do something like steroids, right, which help suppress the immune system and create platelet counts. So IVIG, right, are those? It's usually second line, which is those that don't respond to steroids, and then platelet transfusions, right, is usually if you're bleeding profusely, right, and I can't remember. I think it's under a certain number. I think it's under 15,000 if I'm not mistaken. But going back to this is not super fair, right? But just kind of hone in that the diagnosis is ITP, right? ITP here, right?
Yeah, and I
So
knew the diagnosis. I just didn't remember, and I didn't like not. Yeah. Anyway, sounds
for
good.
sure. For sure. Steroids always going to help because ITP or immune thrombocytopenic purpura is based on usually your body is for some reason created antibodies that attack your platelets. And so doing a steroid, right, you decrease that inflammation, you decrease that attack. And so
Mhm.
your body is still able to make platelets, but now you're not attacking and killing the platelets you have. So it should go up by itself. Does it make sense?
Yeah, yeah.